If you have recently had a hip replacement and are at least 6 weeks post-op from your surgery and are looking to regain your ability to walk like you used to, feel confident putting full weight through the surgical side, and open the doors to adventures, this is the video for you. We're going to go through my 3 favorite movements to help people do just that. If we haven't met before, my name's Alyssa and I'm a physical therapist. I specialize in helping people specifically with osteoarthritis. But prior to starting this business, Keep the Adventure Alive, I worked as a home care physical therapist, helping people recover from total knee and hip replacements. So these are 3 movements I used very frequently. I also want you to know everybody's going to be different in terms of recovery. So make sure you are adhering to any movement precautions that you do have and were given by your surgeon depending on what type of surgery you had. Exercise number 1, you will need a chair. Now, this blue tape signifies this is the leg I have had a hypothetical hip replacement on. I wanted to do this so I can show you how to properly set up. You'll notice if I had surgery on the right side, my chair or my support is going to be on the left. If I have had surgery on my left side, the chair is going to be over here on my right. With exercise number 1, what I'd like you to do is put full weight on the surgical side if you can, and take a step to the side. Then I'd also like you to take a step to the back, meeting in the middle each time. As I step to the side, then step to the back, that counts as 1. You can start with 10 repetitions depending on how it feels. Nice small steps. They don't have to be giant steps. Just go with what your body is giving you right now. If you want to let go, you can, but honestly, I find a lot of people want to ditch the support way too quickly. If you have upper body movement as you're stepping, that can feed into compensations. So you want to make sure that you are doing this in the correct way that allows you to recover. And this is a big one to help with walking. For exercise number 2, you will need a step stool, or you can also use a regular size step, but it may be more challenging. I do recommend using a lower step stool just like this, and the link is going to be in the description below. Notice my chair is still opposite to the side I had surgery, but it's a lot closer this time, and it may even need to be a little bit closer than you think. What you're going to do is put the surgical side up onto the step, push through and step up, and then step down. Step up and step down. Now, if you feel like you do need more support here, you can also set it up this way where you are in front of the chair and you have double-handed support. I also want you to notice something else. As I step down, my hips are sitting back. As I step up, my feet are meeting. Sit your hips back as you do this. Now, this is going to be working your hip muscles on that surgical side. A higher step is going to make this more challenging. A lower step will make this easier. Starting anywhere from about 5 to 8 repetitions upwards to 20 repetitions, depending on how you feel. Exercise number 3 is working on balance. Balance is incredibly important to regain, not only to prevent falls and prevent complications, but also to get the strength back in your hip. What I would do starting out is put the surgical leg in front and the non-surgical leg behind. In a semi-staggered position, I wouldn't start with one foot right in front yet. Keep a space between, but one foot is in front of the other. Now, from here, first you're just going to gain your balance, get your footing, see how it feels. Please have a chair or something supportive near you, or you can go into the corner of a wall so that way you have support on both sides of you and behind you. Now, once you're able to get your balance here, what I'd like you to do is reach out in front of you, one arm and then the other. You can also reach down low to make this a little easier. You can also make the reaches smaller to make this easier as well. The idea here is to feel a slight wobble in the feet and feel those hip muscles kick in to keep yourself upright. You can set a timer for 15 seconds upwards to 60 seconds, depending on how this feels. Then, as long as it's inside of your precautions, you can switch sides, where now that surgical leg is behind and the non-surgical leg is in front. and you can see how this one feels as well. You may notice a little bit more difficulty when the surgical leg is the back leg. And if you notice one foot position is more difficult than the other, that's when you can focus more on. Please keep in mind with all of these movements, the goal is to keep your hip happy and to keep your hip feeling good. Test the waters at first. Sometimes hips can be a little tricky where you feel good doing it, but then you experience some pain and stiffness afterwards. So start on the conservative side as far as repetitions go, and then modify as needed or increase the repetitions as needed. I hope this was helpful. Share with anyone you know who has recently had a hip replacement and is looking to regain their arthritis adventure. Make sure you hit that red subscribe button because I have a lot more videos to help you on this journey to regain the strength and get out there and do what you love. Thanks for watching.